Nearly 10% of all dreams include sex. Wet dreams aren't just reserved for young men. We all get the occasional sex dream. This is true for both men and women, according to a study published by the American Academy of Sleep Medicine. It isn't exactly balanced, however. Women report having wet dreams about politicians, celebrities, and exes. Men, on the other hand, report having wet dreams about multiple partners at once. Women get erections too. Yes, it is possible for women to get slight erections in their own genitalia. According to sexologist Sadie Allison, the clitoris is made up of the same spongy erectile tissue as the penis, which expands and engorges with blood when aroused. You can observe this. Just look at your clitoris or touch it when you're aroused and it will be bigger. 3% of people have no sexual fantasies at all. Justin LaMiller, PhD, reports that 97% of people do have sexual fantasies, leaving the remaining 3% to be boring as hell. Your ex-boyfriend was probably in that 3%. A headache may actually make you more in the mood. This runs contrary to the popular cliché, "Not tonight, I have a headache." It's been reported from people who suffer from migraines that they can experience heightened levels of sexual desire. Why? According to the research done by Timothy Howell, PhD, lead author and research assistant professor of anesthesiology, our study suggests that sexual desire and migraine headaches may be influenced by the same brain chemical. The clitoris is way bigger than you think it is. The part of the clitoris you can see is small, but there's a much larger part called the clitoral urethral vaginal complex. It's located underneath the skin, and it also engorges with arousal. On the rare occasion that a woman is aroused, the vaginal canal lengthens as the uterus is pulled further upward into the body, with the angle often changing as well. Intimacy educator and sex coach Stella Harris says, "Not only is this fascinating, but it's one of the reasons that waiting for full arousal means having more pleasurable sex. Sex is best when your body is ready." Want an orgasm? Leave your socks on. The University of Groningen claims that leaving your socks on during sex actually increases your chances of experiencing an orgasm. It's theorized that this has to do with being relaxed, and cold feet can distract from your pleasure. However, I personally believe that it's due to the fact that wearing only socks feels more naked than actually being naked. It feels more taboo, which heightens arousal. A big penis won't stretch out or ruin a vagina. It's a strange internet myth that having sex with a larger than average penis will stretch out the vagina, or even make it unusable somehow. This is not true. The vagina is resilient and bounces back quickly. It adapts to whatever size penis is going in. Furthermore, the size and shape of the labia are unique to each woman, and is not an indicator of sexual history. Vaginas do tear during childbirth, but this is normal. More than 79% of vaginal deliveries will include tearing, or even require an incision. As mentioned previously, the vagina is incredibly flexible, and will heal itself in no time. An actual G-spot probably doesn't exist. Stella Harris explains, G-spot is a misnomer, as what we call the spot isn't a discrete anatomical entity. Instead, it's an area of the urethral sponge that is highly sensitive for many people. But bodies and arousal are complex, and there's no surefire technique or even erogenous zone that works for everyone. You may have a perceived spot that works for you specifically, but this is different for every woman, and not all women experience a spot. We're talking about sex more, but having it less. Sex is a relatively accepted topic in the media today, yet we are having less of it. Americans in relationships reported having sex 16 fewer times per year from 2010 to 2014, compared to 2000 to 2004, according to a 2017 study. If you ask me, sex is a regularly discussed topic amongst certain groups, but other groups have stigmas around discussion. Men, for example. This leads to a population of men who are aware of sex, but don't understand the full scope of it. The average person's sexual peak is the same age they can rent a car. The average American will have the most sex around the age of 25. People in their 20s have sex more than 80 times per year, or about once every 4 to 5 days. By age 45, this number drops to 60, and then drops to 20 by age 65. This is due to a number of possible factors: decreased libido, increasingly boring sex, and less prioritization of intimacy between partners. Men are always postulating about penis length, but they always forget about the other half of the conversation. When asked, women tend to rank penis length behind other physical attributes like height. It ranks even lower when asked about penis girth, which is often cited as being slightly more important than length. The vagina is mainly covered in stretch mechanoreceptors, which means that girth, or width, is a more important aspect of the penis for women on average, explains Nicole Prouse, PhD, a sexual physiology researcher at the University of California, Los Angeles, and a licensed psychologist. Long and thin gets asked if it's in, short and thick does the trick. The only thing fancy condoms turn on is your credit card. Ribbed for her pleasure? Yeah, that's more of a marketing gimmick than anything. The vagina itself ranks relatively low on the scale of sensitivity. The actual vaginal canal, not the vulva. So much so that surgeries can be done on it without anesthetics. So all those condoms that claim to increase her pleasure with little bumps, not gonna do a thing. More thrusting does not equal more fun. Despite what you often see in mainstream porn, going faster doesn't translate to more pleasure. In fact, it's more likely to be more painful for her. Prouse says, the most common place women experience pain during sex is in the vulvar vestibule, just under the opening to the vagina, where a thin skin stretches underneath the opening that is very vulnerable to abrasion and tearing. This is why generally women do not benefit from or want prolonged pounding, which just drags the penis repeatedly across this area, creating painful friction fairly quickly. We, sex therapists, are not kidding when we suggest not making intercourse the focus of sex. There are good, physiological reasons for playing elsewhere for most of any sexual experience. This is why I genuinely believe that most straight relationship problems can be solved simply by men educating themselves on how to have real sex. Orgasm and ejaculation are two separate responses in men. While ejaculation generally does coincide with an orgasm, the two actually occur in rapid succession, with orgasm coming slightly before ejaculation and tapering off during ejaculation, says Zanit Pillay, sex educator and author of Living an Orgasmic Life. Men can learn to differentiate between the two and to have orgasms without ejaculating. Certainly would make cleanup a lot easier. Want to do better at work? Have more sex at home. Improved sex life has been linked to better performance and even job satisfaction at work. This may be due to the decreased levels of stress a sexually active individual might experience. Men suffer from low libido as much as women do. It's a common trope for men to be up for sex at any hour of the day, any day of the week. This isn't really true. Sex therapist Stephanie Bueller says, the fact is that in practice, the number of couples complaining of low sexual desire in the male partner is about equal. Couples need to accept that it is perfectly normal to have mismatched desires. They should work out their sexual frequency and find ways of initiating sex that works for them. Orgasms. Use it or lose it. It is technically possible to lose your sexual sensation if you go without it for long periods of time. This is more common in women and people with vaginas. In this case, it's called clitoral atrophy, where the clitoris doesn't receive enough blood flow, causing it to retract into the body. Penile atrophy is also possible, but far less likely. It's also typically caused by injury rather than a lack of sexual activity. Fantasies rarely get acted out in real life. This is a controversial one, and one that I myself am still wrestling with. It seems that most people are content with keeping their fantasies as fantasies. In one particular study, less than a third of participants claimed to have acted out their fantasy in real life, without description as to what the fantasy entailed. This presents us with a future video that might ultimately get me cancelled, but hey, we'll cross that bridge when we get to it. Vibrators were first developed as a medical device. Yep, the vibrator was invented in 1869 as a treatment for hysteria, or what was described at the time as a vague and mysterious female disorder. Whenever a woman reported being upset about something, it was documented as an illness, and the prescribed medicine was a large, steam-powered massager to massage the genitals with the goal of inducing hysterical paroxysm, the Victorian-era term for an orgasm. Better than burning the witch, I guess. 75% of women don't orgasm from regular sex. A lot of women get worried that there's something wrong with them when they don't experience an orgasm from vanilla sex. This comes from a wide misunderstanding of female pleasure. 3/4 of women need direct clitoral stimulation to get them there. Some people actually experience a vaginal orgasm and a clitoral orgasm at the same time, the legendary blended orgasm. The egg does not choose the winning sperm. A lot of depictions of contraception present this idea of a sperm race, where the first one to the egg gets to fertilize it. Sexologist Jill McDevitt corrects this idea. The narrative is biased with our cultural lens about men being competitive, while the egg, the woman, sits around passively. Eggs have sophisticated biological mechanisms that actively choose which sperm they allow in, and isn't always the first one to arrive. Just because you've completed intercourse doesn't mean you've really had sex. This one is less of a fact and more of a hot tip. You know what the home base is, but do you know about all 4 bases? I tell people to make sure they make it to each base before heading for the home run, Miller says. The bases are 4 Fs: Frenching, meaning kissing, feeling, fingering, and fucking. A good baseball player would never skip first through third base before sliding home, and neither should you. The celebrity sex bucket list isn't as common as you'd think. The sitcom Friends may have popularized this idea, but it really isn't all that common. It's the idea that each partner can keep a bucket list of hall passes, so to speak. Famous people that, if given the extremely odd circumstance, it would be okay for you to sleep with, and it wouldn't count as cheating. Apparently, this isn't all that common in relationships, probably because we have enough cheating as it is. Older people have some of the best sex. We've already established that the frequency of sex tends to decrease as we age. What we haven't discussed is the quality of that sex going up. This could be due to a couple getting really good at knowing each other's bodies and their pleasure points. It may also have something to do with the fact that a couple successfully staying together for that long often comes packaged with a healthier lifestyle and therefore healthier sex. Sex toys are unregulated. You would think that such a controversial subject would be subject to a mountain of regulatory laws, but this is far from the truth. Sex toys are not currently classified as medical devices, and therefore don't face the same scrutiny. Jessica Gordon, founder and managing partner of an intimacy boutique, says, "There are items on the market today made from materials that are prohibited from use in children's toys. Be very wary of the secondary market or third-party sellers on platforms like Amazon and eBay. Buy only from trusted sources that are committed to selling only bodily safe and non-toxic sex toys and lubricants." The most popular sex fantasy isn't Princess Leia in a gold bikini after all. This is also something popularized by Friends, if I'm not mistaken. According to this source, the single most popular fantasy among Americans today is group sex. This is followed closely by BDSM, novelty/adventure, and taboo/forbidden sex. Too many solo encounters can make sex with a partner more difficult. A lot of men suffer from delayed ejaculation, where men struggle to have orgasms in conventional ways. Basically, they've gotten used to the exact sensations and pressures produced by their hands in solo masturbation, and they find themselves unable to ejaculate vaginally or orally. Masturbation is itself healthy, but you shouldn't treat it as a replacement for intimacy. Easier said than done, I know. Your vulva is not your vagina. The vagina is a 3 to 6 inch muscular canal that runs from the cervix to the outside of the body. The vulva is all the outer parts, the labia, urethra, clitoris, and the vaginal opening. The vagina is the hose, the vulva is the nozzle, but reverse the direction. The penis and vagina account for less than 10% of erogenous zones. The entire body is capable of arousal, pleasure, and stimulation. so making sex focused solely on genitals can lead to performance pressure, says Cindy Darnell, an Australian clinical sexologist, sex and relationship therapist. Now, everyone is free to have sex in whatever way is most pleasurable for all parties involved. But sometimes, people don't realize what they're missing out on when they go straight for the genitals over and over again. You don't appreciate the value of the entree when you skip to the dessert every single time. The A-spot. The anterior fornix, or the A-spot, is a little alcove that sits way back on the belly side of the cervix, a good distance deeper in the vagina than the supposed G-spot. This information comes from a study published more than 20 years ago, so take this with a grain of salt. Stimulating your A-spot is an easier way to create more lubrication in the vagina. Participants in this study reached orgasm slightly faster than the average woman, about 10 to 15 minutes, down from the usual 18. You can have an STD and not know it. STDs are sneaky little bastards. Even if you're careful and know exactly who you sleep with, you may have one of these dangerous infections. This isn't a scare tactic to stop you from having sex, but it does happen more often than you think. Robert Huizenga, MD, author of Sex, Lies, and STDs, says, "Far too many people forget the fact that STDs don't always present with obvious telltale symptoms. If you're a sexually active adult, you should receive regular screenings." You can't tell if your partner has an STD just by looking. A common sex mistake people make is mistaking good hygiene for good health, says Nani Ayana, sexologist and founder of ERIS Consulting LLC. You can't assume someone is STD-free when they show up to the date looking clean. STDs are shockingly common nowadays, especially HPV. You can never be too careful. Always having an open dialogue with your partner on signs of STDs is a good thing. Desire doesn't always come before arousal. You have to be careful with this one. For many individuals with low libidos, you may not desire sex until you become aroused, not the other way around. Irene Schreiner, a licensed marriage and family therapist at Solid Foundations Therapy, says, "For lower sex drive people, sex generally isn't on their mind and they don't just get in the mood. Oftentimes, for them to feel the desire to have sex, they need to be aroused first. That's why regular flirting and physical affection is so important. Nonverbal flirty cues do play an important role in maintaining intimacy, and you should never force your partner into thinking they want sex if their sex drive is low. No couple is perfectly balanced in the bedroom. If we could get our sex drives in sync, life would be a dream. Wrong. There is no perfect in these matters. Libidos change all the time. Something as small as a bad cup of coffee in the morning can make sex a no-go in the evening. There is a low desire person and a high desire person in every relationship, says Schreiner. Only by removing judgment can each person work on acceptance and create a happy compromise. Sex doesn't have to include an orgasm. The thought that sex has to lead to orgasm isn't inherently true. Yes, it's generally accepted that that is the goal, but it's okay if you don't make it there. After all, we don't call it sex only if one or both partners reach climax. Putting pressure on the other to achieve climax will create unnecessary anxiety in them. Sex is meant to be a fun activity, not a race. 1 in 6 women have never had an orgasm. And it's all your ex's fault. Some of these dudes out here just don't know how to get it done. To the women out there, if you have an incredibly difficult time reaching the climax, you're in good company. There's an imbalance in straight sex. One party is trying to hold back, while another is trying to get there. Someone is always going to end up having a worse time. But remember, an orgasm isn't even necessary for good sex. The most effective sex toy is your voice. From Melody Lee, licensed marriage and family therapist, associate, and relationship specialist. American culture has long shamed women that take charge of their sexual pleasure. So I encourage partners to take the guesswork out and speak up, verbally or through touch. It's perfectly okay to ask for what you desire. Speaking as a man, we really just want you to say exactly what you want, even if you don't know exactly what you want. I think most guys would oblige because it takes the pressure off them to perform. They don't have to guess. Sex therapy isn't just for virgins or sitcoms. A sex therapist will talk you through your bedroom problems. If you're having a problem, getting professional help isn't a weakness, it's a strength. You might be anxious to open up to a complete stranger, but that is how most people meet their partners anyway. The pull-out method doesn't really work. The pull-out method often replaces using a condom, or other forms of protection. The man will quickly withdraw his penis before he ejaculates, stopping conception. Pulling out is better than doing nothing at all, but it's not enough to guarantee your safety. Zvi Zuckerman, MD. The problem is that it requires the man to have a high level of control over his ejaculation, and also a great deal of responsibility to pull out in time. If the ejaculatory spasms have already begun, a few drops of semen in the vagina are sufficient to cause pregnancy, even if withdrawal is quick. Every drop of semen contains a large quantity of sperm. Sometimes the man won't even feel the first drops ejaculated. Even just the pre-cum can get you pregnant. Up to 18% of women using the pull-out method will get pregnant within 1 year. Sexting can improve your relationship. If you're an adult and you're in a committed relationship, you could try spicing it up with sexting, as long as it's consensual and you're an adult. A cucumber is not a sex toy. According to a totally real and professional Yale study, the only acceptable phalluses to receive will be made of silicone, steel, Pyrex, glass, or specially laminated wood. Anything made of vinyl or latex should only be used with a condom. Any food product can cause a yeast infection, which will require a very embarrassing trip to the doctor. Sex is powerful medicine. Sex is fun, sure, but it's also life-saving. Regular sex can improve mood, boost your immune system, and even reduce risk of cancer. Not to mention stress relief, because God knows we all have enough stress right now. Unless you're stressed about having sex, I guess that won't help. The vagina is self-cleaning. On the vagina, there exists an army of bacteria that work to keep the pH levels in check. This wards off other, hostile bacteria. This may lead to discharge, but it's totally normal. Cleaning techniques like douching are a bad idea because they can throw off this natural balance, leading to problems like bacterial vaginosis and infection. You can get wet without being sexually aroused. Wetness can occur for a variety of reasons: hormone levels, sweat glands, and even automatic lubrication. Yes, a vagina may become lubricated with a random touch, whether or not it's meant to be sexual. It's actually quite similar to penile erections. You don't always get hard because you're aroused, right? Any brush with any object, or sometimes it just happens for no reason at all. Vaginal wetness is never a sign of consent, just like an erection isn't a sign of consent. Vaginas get deeper when we're turned on. Aren't these things fascinating? Self-cleaning, moves on its own. Very strange anatomy. Normally, the vagina is somewhere between 3 to 6 inches long. Good news for all the men out there, you're probably on the upper end of that. But just in case you're bigger than that, the upper portion of the canal elongates, creating a bit more room for lengthier members. Vaginas also change color. When you're horny, blood rushes to your vulva and vagina. This can make the skin in that area appear darker by comparison. After sex, it'll go back to its normal color. Fantasy sex isn't that sexy in real life. A lot of men will try to recreate what they see in porn in real relationships. And more often than not, this misses the mark. You don't need to do these crazy backflips and pile drivers. Although, it would be pretty cool if you could pull that off. Most sex is gonna be pretty basic with basic positions. It's less about the position and more about the rhythm, which is lacking in most pornography. The secret to mind-blowing sex is lube. Maureen Miller, PhD. Put a drop or two inside a condom before you put it on. You'll wonder why you never did this before. While this can make it more fun for you and your partner, you should check the ingredients label to make sure neither of you are allergic. Lack of erection doesn't mean he's not turned on. Yeah, sometimes it just doesn't happen. Most of the time, it's due to heightened stress. Maybe you really put the moves on him and he's feeling a little intimidated. It happens to everyone sooner or later. If you see yourself having trouble, you can always take a break to clear your mind. If you're having persistent problems, see a doctor about some ED medication. 80% of women will experience chronic, painful sex. Sex should never hurt, but it seems that that's the reality. Tara Langdale-Schmidt, a pelvic pain expert. If this happens to you, don't be ashamed, she says. Don't let a doctor tell you that your physical pain is in your head, or simply put you on medication or antidepressants, which they try to do frequently. That is not an answer. Know that there are many resources they can turn to for help and information and new treatments that can help. To all the guys that think they need a cervix-crushing dick, do you really want sex constantly stopping and starting over and over just to not hurt your partner? If you have one of those, you'll have to do some work to make sure they're not in pain. Most women can have more than one orgasm, but few take advantage of it. Ah yes, the thing that balances the scales for us all. Men have faster, more reliable orgasms, but can you imagine stringing 5 of those together? What an experience. The real problem here is that there just isn't a sex school for adults that shows them exactly what they need to do. But you know what? I'll get right on that, actually. Post-sex sadness is a real thing. This isn't just post-nut clarity. Post-coital dysphoria, or PCD, is characterized by intense feelings of sadness, anger, and even distress after orgasm. It's not known exactly why this happens, but it's been theorized that a surge in hormones may be the culprit. Of course, past sexual trauma might play a role as well. Cherries don't pop. Most people who have a vagina are born with a hymen, which is a thin piece of skin that stretches over the opening of the vagina. The vagina, not the vulva, remember that. Despite the mainstream terminology of the cherry, these pieces of skin don't exactly pop. Your hymen could tear from riding a bike. It's not exactly the best indicator for sexual activity. Now, if it does tear during sex, it can be traumatic for a lot of women. If you're the guy, and this happens, keep in mind that she might feel a lot of undeserved guilt. Just keep telling her that it's okay. Vaginas are supposed to have a smell. The vagina bacteria are back for vengeance. It's just something that you have to deal with. Don't try to cover it up with body oils or perfumes. As long as you're cleaning yourself regularly, you should be fine. A strong sense of smell can make you more orgasmic. A study that was published in the Archive of Sexual Behavior found that people with a more perceptive sense of smell had better sexual experiences. Women who had a better sense of smell reported having more enjoyable orgasms than those whose noses weren't as sharp. However, the study found that this wasn't actually linked to sexual desire or performance in the bedroom. This suggests that the heightened state of pleasure is triggered by body odors like vaginal fluid and sweat, that those people can smell more easily. Smell is an underrated part of sex, but we'll keep that in the pocket for a future video. Sex increases your immunity to pain. During sex, the hypothalamus releases oxytocin. For women, this burst of hormones can reduce the pain felt during menstruation. In men, it can actually cut the perception of pain in half. Having sex can actually trigger your creativity. Finally, something that applies to me. It makes sense. Sex is already the purest form of creation. You're creating a new life, after all. It's oxytocin again, creating flexible cognitive pathways in the brain. This has the benefit of increasing potential for creative thinking and problem solving. The clitoris has twice as many nerve endings as the penis. The penis has around 4,000 nerve endings, and the famously hard-to-find clitoris has around 8,000. What this means is the clitoris is generally more sensitive. It only makes sense to focus on the clitoris as a pleasure point, since women are already starting at a disadvantage. You want to sync up your orgasms? Focus on the clitoris. People who have less sex overcompensate in their jobs. People who are lacking a sex life when they desire one tend to fill the void with work. This was found through a study that asked 32,000 people to open up about their sex lives and their work habits. Around 35% of both men and women who only had sex once a week also worked excessive hours at their jobs. Most orgasms aren't earth-shattering, and that's okay. Porn creates quite a scene when depicting an orgasm. A lot of moaning, yelling, screaming. I've never been one to turn the sound on when watching porn, but when I do, I'm guaranteed to get a laugh every single time. In reality, orgasms are varied. They might be short and sweet, or loud and powerful. I would predict that most orgasms tend to be pretty muted. When you're masturbating, you're not usually screaming to the rooftops. You can lift weights with your vagina. So here's how this works. Vaginal weightlifting, the act of inserting an anchor into the vagina that's attached to a weight on a string, is actually a way to strengthen your pelvic floor. Sex and relationship coach Kim Anami is a vocal advocate for the exercise. She says stronger vaginal muscles can make sex last longer and feel better. New Olympics event just dropped. Better get out of the splash zone. Most women don't know their bra size. Yes, 80% of women are wearing the wrong bra size. If I remember correctly, it's bust size minus band size to find how many inches off your chest your breasts sit. There's a bit more to it than that, but it's not just lower letter equals bigger boob and higher number equals bigger boob. A double D size bra will look smaller on someone with a larger band size. The average man lasts about 5 to 6 minutes in bed, while the average woman needs about 18 minutes to climax. Also, men tend to overestimate this duration by about 31%. An improvement in endurance and skill could bridge this gap. Find out what she likes, and make that your opening gambit. Sex wasn't greatly stigmatized or taboo until the Middle Ages. Before this, ancient Greeks and Romans enjoyed group sex, homosexual acts, sex toys, porn, and even birth control without thinking about it too much. How far we have fallen. No, but it's a legitimate question. Why have we become so prudish? In an era where medicine far outpaces the concoctions of past generations, we're more weird about sex now than we used to be. Is it because of increased awareness? Poor schooling? This is something that I aim to change.